All right, we are live. I am here. I'm Dr. Anthony. I'm Dr. Tony. I'm here in Upland, California, right outside of Los Angeles. This is Christine. She is outside of London. We're about 13 hours away. I had to map it earlier to figure out how far it was. Thank God for things like Zoom and StreamYard allow us to do these things online. And at this point, very, very clear, I think. We've kind of ran through it a little earlier. And it's going to work out pretty good. Hopefully, if this sounds in your problem, let me know. But overall, it's going to work out well. This show is about staying healthy if you have scoliosis, if you're a teenager, if you're an adult. How do we do this? So when you have it, it is a lifelong, I don't want to call it a disability, but something you're going to have. How do we keep our bodies and our minds healthy so we can be healthy and happy through our ages, maybe in your teens, your 20s, 30s, 40s, 50s, or above that? So Christine's been doing this for about 6 years now. She was a scoliosis. She'll talk about her history with scoliosis. And now she has built up a huge following, if you want to call it a national and now international following with this show, to make her word and message that is very competent and very skillful and very step-by-step how to recover, how to feel good, and how to stay well with scoliosis. So Christine, take it over, share your bio, see what's going on.
Oh, thank you so much, first of all. Thank you so much for having me. Yes, so I was diagnosed myself with scoliosis when I was a child, really. So I'm from Germany originally. So
Okay.
back in Germany, we had they did scoliosis screening, which we don't. I think you might have it in the US as well. We don't have it in the UK, but it was so it was picked up very early on. But it was, it was back in the 80s. There was a little bit of monitoring. I did have some physio, but then they were kind of saying like, oh, let's wait and see what happens.
It was vague, right? Vague. That's still now too. Is wait and see how bad it gets, because then you can do other things with your body at that point. Correct?
Exactly. So yes, so very much wait and see. At some stage, I did get a heel lift in my shoes because they thought, oh, a leg length discrepancy, and maybe we can correct it that way.
Got it.
And it didn't cause me any kind of real issues until kind of my teenage years, which is when I started to have back pain. And whenever I went to see someone, it was very much, oh, you've got scoliosis, and there started to be that link, obviously, for me as well, that back pain, scoliosis, there's obviously there. And I did all the rounds of different therapies of chiropractors and osteopaths and acupuncture, you name it, trying it all. And it's all really helpful. It's all super helpful. But I kind of...
What year did they diagnose it as scoliosis for you? How old were you?
I was 5 or 6.
Okay,
so I was young. Really young, yeah. So I wasn't even in the kind of the normal age when it gets diagnosed. Normal age is kind of between 10 and 15, isn't it?
Same here. Yep. Same here. Yep.
Adolescent years, but I was earlier on, really. But yeah, then it wasn't, except for a little bit of physio and that heel lift, there wasn't anything else that was done about it. And then when I started to get pain, it was kind of, I was past that growing age where you could actually really do something about it. So yeah, I kind of missed that opportunity, that window, unfortunately. But then I kind of realized that I had to do something myself about this, because it wasn't, as you said before, it's a condition that is not going to go away. It's not something that magically will disappear, or you get all of a sudden cured and have a super straight spine. So it was kind of, I went through this whole phase of, right, what am I going to do about this? I know I have to stay fit. I know I have to move. I know I have to do something. I have to be proactive about this myself. And so this is kind of when I started to get into yoga, after trying a few different kind of Pilates and different exercises. But yoga was something that I instantly kind of connected with, and it made me feel better from the first time I tried it. So from the first
meaning better back pain, less back pain?
Less back pain, yes, absolutely. And now obviously looking back, it could be a it could be all sorts of things, it could be that mind-body connection. Maybe it was just the breathing. Who knows, but it made me feel better straight away. And this is when I kind of got into yoga and got really into practicing quite regularly and on a daily basis.
How old were you, ish?
I was in my early 20s.
Okay.
I was early 20s. I turned 40 now this year, so.
Yep, 46 myself. I understand.
So yes, a while back, but it was quite a strong practice, I would say, that I had. I really, really enjoyed it. And then kind of the scoliosis part came in a few years in when I found that something was still, obviously I had less pain, but there was always this kind of this imbalance, when I was like, I'm doing things, but they don't feel the same on one side to the other. I can't do it so well on one side than the other. And I know everyone has a little bit of this.
Yeah.
But I found it quite extreme. And I found that yoga teachers would come to me and like always correcting me all the time. So I kind of felt like something was wrong. And I needed to be more specific. So that's kind of when I got more into doing my own research of, scoliosis, what is it, what effect does it have, and what happens with the muscles and bones, and and how can I kind of tailor my practice a little bit more towards that curvature of the spine.
I mean, in practice of you practicing your own, or you practicing to help other people at this point?
At this point, it was still for myself.
Okay.
At that point, it was still for myself. Because I firmly believe that you have to feel it yourself first, and you have to kind of experience. Especially,
it's hard to teach when you haven't experienced something, to give people the real idea of I'm going it through with you. I can empathize with you. I can actually know what you're going through, if it's pain, emotional stress, whatever it is, because I've been there before too.
Yes, yeah, and it definitely helps me now with my teaching. And I always, when I work with people and they explain something to me and they're like, I don't know if you can relate to this, and I say yes, obviously it feels like this and it feels like that, and they're like, yes, exactly.
How do you know this?
How do you know? Yeah, exactly. So that's when I kind of started to do all the research and get a little bit more kind of specific.
And what do you do the research? How did you get your research? Was it more online? Was it more talking to people, instructors? What was your research base? So
I came across a yoga teacher called Elise Browning Miller, and she actually has a studio in California. I think it's near San Francisco, I believe.
Okay.
And she had published quite a lot of articles about yoga for scoliosis. She's also written a book called Yoga for Scoliosis. And so she was kind of, at that time, kind of the only one that would do something like that. And I found it really fascinating, just her knowledge. And she has got quite a severe scoliosis herself.
Okay.
And how she kind of described all the tiny little adjustments that you can make, and it all kind of made sense to me, that when you turn one way it feels different to when you turn the other way, and making space in spaces that maybe feel kind of restricted and tight, and other places feeling like there isn't anything, and you want to strengthen them a little bit more. So I started to kind of follow her. We did read everything that she did. Eventually, she did come over to the UK, so I did train with her as well.
Great.
And then more recently, it's really doing a little bit like what you do as well. Talking to lots of different health professionals, and not just yoga. There's so many different therapies, obviously, that can be helpful, and there's so many specialists out there as well.
Well, a lot of I think is there's things like chiropractic that will, with yoga, with massage, for example, or even with a trainer, can complement each other. So we work together to get the person better as a whole. So and I think when you have that bigger picture, like you're saying, that point, okay, I may be able to help you here, but doing this too may give you a different level of help or assistance or strength to help avoid the pain.
Yes, yeah, absolutely. Yes. And it all, as you say, it all works together, and it's just kind of fitting all the pieces together. And at the end of the day, there's not just one way that works for everyone. Unfortunately, it doesn't work like that. So you have to kind of put in some work and try a few different things, and then kind of build your own health team, really, isn't it? And people that can help.
As a patient for me, or as a client for you too, it's almost giving someone enough tools, enough resources to go, okay, let's try this, this, and this, and see what you like to do. What's gonna motivate you? Maybe the person behind, say, the doctorship or the yoga or the instructor, or maybe a different personality if need be too. What's going to motivate you to get to the next level, so it pushes you to work outside your comfort zone to get yourself to healthier states.
Yes, absolutely. Yeah. Absolutely. And I always say to my clients, look, the yoga at the end of the day is only going to work if you actually do it, right?
That is the key.
If you don't do it, if you find it, whatever, if you don't like it for whatever reason, if you don't like moving this way, if you don't like the relaxing and the breathing and all of that, try something else. There's so many other things out there for you, but it's more important that you actually do it.
I think a lot of you are trying to help someone, no matter if it's with you or somebody else, get yourself healthier. Get yourself to the point where it's going to, whatever you can do to get yourself to a better state of health, so it doesn't affect you down the line where you might need surgery, and that becomes permanent for you. Then you have long-term, lifetime problems that become a disability for you.
Yes. Yeah, absolutely.
And Christine, who do you deal with normally? What's your demographics like? What's your age group that you, if you want to call it the high and the low end? What's your male, female? What's your demographics like normally?
I mean, with scoliosis, there tends to be more women that have it, at least to a point that it needs treatment. So the ratio, they say, is 7-1. So it's definitely a lot more women that would be affected. For me personally, I've worked with all sorts of ages. I've worked with children and teenagers. But really, the kind of the most part of the people that I work with are people who have been maybe diagnosed in their early years, in their teenage years. They, similar to me, maybe they have been wearing a brace, or maybe they've had some physiotherapy.
Yep.
And then they kind of went through their 20s and 30s, everything being okay, not really thinking about it. It just kind of being there at the back of their mind, maybe not being completely happy about their appearance, but otherwise not being a big deal. And then they get to their 40s, 50s, and then it kind of gets to that stage where they're like, oh, actually, it's getting worse. Starting to have trouble, starting to feel really imbalanced, back pain. I need to do something. So that's really kind of that I would say this is my favorite people to work with as well. And they're the ones that are really kind of looking to be inspired to kind of take back some of that control that maybe they lost when they were when they were younger, and then when everything was about the doctors and trying to kind of do everything they could, and then they say, well, look, we can't do anything for you, so you're on your own.
They're mature enough to go, look, this is my body. I have to be accountable. This is what I have to do for me and my family, so my next 30 years, 40 years will be better. I have a better quality of life. And now I'm financially and I'm on my own, independent, hopefully at that point, where I can take care of myself. I've learned that now, how to take care of my scoliosis along with myself, so my overall body quality of life improves.
Absolutely. And I think we now we kind of expected, we want to feel great when we're in our 80s and 90s. You don't want to be sitting in a wheelchair, or not being able to do anything. And if you've got grandchildren, you want to play with them. You don't want to be the one who sits in the corner and can't do stuff.
What I think a lot is when and that's me being 46 or you being around 40, you look like you're 25, for example. A lot of it is can we get to the point where, okay, if I'm thinking 30 years out, what do I have to do now to make that quality of life better? And because I'm mature enough, hopefully at that point, and I have no problem if it's worth it to me, I'll pay for something to make my life that much better. So by doing things now, I'm putting in the work, the sweat equity, so people call it, so that when your body can be better 30, 40 years from now.
Yes. Yeah, exactly. Definitely. And when you're a bit younger, you know, maybe don't think so far ahead. But I think
I'm gonna live another 10 years. I'm gonna live another 5 years. I'm invincible. All those things happen to all of us. I think we'll do this.
Yes, and you kind of think it keeps on going like this, right? But then
wait a second. Gray hairs come in, things are a little bit tighter, more sore. It's life, you know. Yeah. And sometimes when we're younger or older, we only can see our little path, our little tube, if you want to call it that. At that point, it's hard to see in front or behind us. What you're doing too now, talking about some of your classes, some of your steps I saw online. How does your classes work?
My classes, so pretty much even before this whole pandemic thing, I was teaching online quite a bit because, well, this scoliosis is, okay, it's actually more than you think, but still, like in my local area, I don't know how many people there are that have scoliosis. So I always knew I had to go a little bit wider because it's very specific, right? What I do is it's a very kind of niche thing to do. So I was using Zoom two years ago already, kind of for this type of teaching. I was still, you know, I was doing kind of one-to-one sessions around here, this area, but I was really interested in kind of reaching a little bit of a wider audience and bringing this onto YouTube, because I kind of found that there's a lot of rubbish on YouTube generally.
Yes.
I found in terms of scoliosis, a lot of like promising quick fixes, and like if you do this every day, 4 minutes a day, you know, for the next 2 months, your scoliosis will be gone. Things like that, you know, where like, come on.
And then pay me 200 pounds for this one talk, and we'll talk about it, and we'll give you the magic cure, the magic pill.
Yes, all that. Yeah, exactly. So I was quite committed to sharing what I know, what I've learned, and I still, you know, I started my YouTube channel back in 2017, and I kind of started it without any expectations, and more as a way of sharing what I learn along the way, rather than thinking, oh, I know everything about this topic. I need the world to know. It was more like a way of let's figure this out together. So that community part was always really important to me, because I feel like sometimes, and I hear this all the time from my clients, that people can feel a little bit isolated, or like thinking like nobody else around me understands scoliosis or has scoliosis, maybe not being talked about, or simply not knowing anyone who's got it and who could relate. So that whole community part has always been quite important to me. Yeah. And this is really how I kind of build up my business around it, that I do my YouTube channel, I put out my practice videos, and then for people who want to go deeper, who want to learn more, and you know, who are interested in learning more, they can either work on a one-to-one basis, or I do online courses. So kind of smallish group sessions, group environment sessions, again via Zoom.
What I love is I think I like how you built up your, if you want to call it your search, your group, by just sharing what you were learning yourself. And that road, that journey that took you, this is 2021, now it took you the last 3 years to build, where you built up a reputation, a brand for you, that you knew what you're talking about. And you were someone who can empathize with someone who might felt isolated into their mindset to make them feel comfortable. You know, I made, and you'll talk to them genuinely too, not salesy or marketing. This is what I do. This is what I go through. If you want my help, I'll help you. Is that kind of what it seems like?
Yes,
Or
yeah,
develop
definitely,
into?
and
Yeah.
absolutely, and always being quite. Yeah, I like to. I mean, this is, it might be my personality or how I like to teach as well. I don't like to teach in a way that, here's all the answers for you,
Uh-huh.
but it's more like this. Here's some suggestions for you,
Mhm.
but really it's about you. Always kind of putting it back, because I feel that is what is empowerment is not somebody
Good.
telling you, presenting you with all the stuff, but it's kind of giving you tools, as you said earlier on, and empowering you to dig a little bit deeper, to explore. And yoga is a lot about kind of self-study. It's about learning what is going on, and the whole, we can go into the whole body-mind connection, obviously, but
Well, a lot of it is what you're talking to is when you're talking to someone about them, they're at it. Everyone's at a different journey, correct? Everyone at a different stage. They may be younger, maybe older, maybe dealing with some pain, maybe not a lot of pain, and that pain level may change day to day. Their stressors in their life may change day to day. Right now, the lockdown you guys are having too, that isolation is even more exponential. So how do you get that connection first and build that confidence that someone wants to exercise, someone wants to do yoga, someone wants to take care of their health when they're under stress and they may feel some type of anxiety or depression. You're helping them kind of break through that. Let's get you better. It's about you, not about the program, not about this group. It's about you getting better yourself.
Yes, absolutely, and I think you touched on it as well before. It's a lot of it is that connection between the therapist and the client, isn't it? And there has to be some level of trust, obviously,
Mm-hmm.
and sometimes it's just that empathy part, and knowing what they're going through, that makes all the difference at the end of the day.
And when you talk about empathy, it's something where, like you said, you can empathize. You've gone through it, but also, if you have to push someone more than they're used to with a stretch or with a routine, they can go, okay, she's done it. I trust her. Even though this seems painful right now, let me see if I can get through this to get the better state of health.
And this is a very important thing, and it's something that I see a lot with scoliosis, that a lot of people, especially when they're in pain, and I'm sure you see it all the time, their instinct, the first thing to do is to do nothing, right? It's like, I'm just gonna sit here. Then nothing can happen to me, right?
It can't get any worse, right? It can't get any worse.
I'll be safe. So safety is, I hear this all the time. I like, which movements are safe? Is it safe to do this? And I always say this, look, the least safest thing that you can do is do nothing, right? That's probably the worst thing.
It's almost human nature, though. It's human nature when you're under stress. It's mental to kind of lock in and avoid any new stress that will seem, at least at that moment, going to make you worse, make you more. So you have to get someone, in my sense, to understand that uncomfortableness, that next pain will get you through all the pains to get better state of health. So that point, you get the next step even after that and that and that. But you have to start the momentum slowly, I think, with someone's mindset, and then build them and breaking through the first step, the first wall, so they can feel that difference.
Yes, yeah, definitely, absolutely.
What does it take someone to see that benefit of, okay, if where am I now, and how do I get to a better state of health? How do you see them change, I guess, mentally first, and what's the first steps you take with them to get them to feel different?
There's a lot of the way I work. There's a lot of education. First of all, there's a lot of kind of understanding of understanding the condition itself, because I think a lot of it is, I don't know why this is happening. Why do I feel this way? And why is it always like this? And then I do like to talk to them about other people as well. So that's a big part of it that I talk about. I've got other clients, they feel exactly the same. I have felt it this way, so that they feel that they are not alone. They are not like, I'm the only one who's this has never happened to anyone before, but it's only me. But there's different types as well. But as you say, you have to sometimes go really, really slowly.
Mm-hmm.
And maybe that will just be one session lying on your back and breathing and feeling what's going on in your body, right? And a lot of those with scoliosis have a little bit of a disconnection with different parts of their body. They feel one side, they feel like it's, they might have a prominence on one side, the rib cage, with the rotation. So they feel like everything is happening, everything is about their right side. Yeah. And the left side is like, oh, actually, if you ask them about it, how does your left side feel? And they're like, I don't know. It's almost like it's not there.
So worry about the right side, that their left side is like, let me worry about the problem side first.
Yes, exactly. Yeah. Everything is on that problem side. So a lot of it is just kind of shifting the focus a little bit and shifting the awareness to maybe some parts of your body that will feel good, which there are probably more than you think. Mm-hmm. And then maybe also some parts of your body that have been kind of forgotten about a little bit, and maybe giving them a little bit more awareness, and then just kind of working slowly. But sometimes I feel as well, if you have a condition, if you've been diagnosed with a condition, you start to identify with it, right? And I'm sure you see this.
What do you mean by that? I know what you mean, but what did the audience? How would you describe that?
I would describe it as, it's kind of something like the second thing you want to mention to somebody who meets you.
Mm-hmm. Yep.
My name is Christine, and I have scoliosis. Not that they would go around this way, but I've got people,
they've associated their life, their personality with that condition.
With that condition, exactly. Whatever. I like gardening, and I have arthritis.
Okay, that's fine.
Yes, so it's kind of, and this is a whole mindset, thing. Obviously, this is not something that you can that will change overnight. But it's working with this knowledge that people will feel, it's everything that is happening in their life is because of their scoliosis.
How do you help them get through that and understand how to separate as a condition that is treatable to the point of non-symptoms, the not feeling problems, for example? How do you get them to shift their mindset?
Well, it's a lot of the way I work is about acceptance and learning to have scoliosis, kind of see it as something that it's a condition. Similar to, I wear glasses, right? Mm-hmm. So my eyes are not perfect, but I wear glasses, right? So it's fine. I'm not gonna go around and
hey, look at these things. Yeah, you don't say that. No.
Yeah, exactly. No, I don't do that. So it's a condition. It's there, and what we're doing is kind of optimizing the way we are, mm-hmm. and really kind of accepting the way the curvature is. It can be, just because you have a straight spine doesn't make you any happier, doesn't make you kind of achy, it doesn't make you more beautiful. It's kind of working around this mindset issue. And what is really helpful is obviously to see some other people, like, there is quite a famous Victoria's Secret model. What's her name? Martha Hunt.
Okay.
Beautiful, stunning woman who's got scoliosis. There is Usain Bolt, the fastest man ever. He's got scoliosis, right? They're not weak. They're not broken in any way. They're probably not going around everywhere saying, I've got scoliosis, I can't do this.
That's it. I only can break the world record so many times, And again, we may never be a Victoria's Secret's model, you or I, or run faster than Usain Bolt, but can we get to better state of health?
Exactly.
It's going to be having these examples of people to go, if they've done it and they've gotten there, how do I take the steps? Do you see people that have that positive attitude, that hope, or do you have people that come in and go, look, this is the end, I'm here for a desperate chance to get this thing better, or do you have a range of people like that?
Yeah, there's definitely a range of people, but really, if you want to make a change, there has to be some commitment from you. There has to be that openness and that willingness to put in the work, right? Otherwise, it's not going to work. At least the way I work. If somebody comes to me and just says, give me the 2 things I need to do every day, then I will say, look, sorry, that's not how it's going to work. You're going to have to put in the work yourself, really. And there has to be that commitment from both sides. Obviously, I will help you, but you have to kind of be willing to help yourself.
You almost have to help them 20%, but have put in the work 80%. So even if I may not be in a Zoom call or a StreamYard call with you every day, when I'm not with you, make sure we're doing this, 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 and this. When I see you, then we can take the next step. If you haven't done those steps first, step 1, we can't go to step 2.
No, exactly.
And with your steps that you do take with your clients, how do you start them off normally? What's a normal, I guess, step 1, 2, and 3 to get them to where, okay, now I'm seeing the progress now?
Yeah, it depends on if they have pain or not. It's kind of the first thing. So if somebody is dealing with pain, I would work slightly differently, and we would work on the symptoms first. So we would, start to kind of do a little bit more kind of releasing work. Depends on what it is, obviously. If it's something where I know, look, you're better to see a chiropractor, or
then come and see me afterwards, right? Yeah.
Yes, exactly. Then come and see me afterwards. So I always get them to, obviously, you have to distinguish a little bit between different types of pain, I guess, or sensations, and that is a whole other thing. Obviously, talking about pain, and pain isn't pain, if you know what I mean.
So it takes experience, though. It takes experience of doing it for 6 years now, and having your groups for about 3 years. Okay, what's this person going through? Is it a medical condition, or is it something I can help them with to work through? If I'm going to have a line, okay, can I help them, or they have to go somewhere else first to rule in or rule out a medical condition, and from then I can help them once it's been ruled out, or get through the medical problem and then come back to see me.
Yeah, I mean, you have to go with your instincts a little bit there.
Yeah, exactly. Experience. Yeah.
Yeah, absolutely. But generally, if it's something that has been there for a long time, I know that this is something chronic, obviously, and we'll be able to try a few different things and see how it works. If it's something that I did something a couple of months ago, my shoulder isn't quite right, then I would say, look, go and see someone first. Make sure that this is all okay. Get a treatment, get an X-ray.
Do people mostly in the UK, do they run to the medical doctor first, or do they go to more natural healing before they go to a medical doctor? What's the perception or social norm there?
Yeah, interesting, isn't it? Because that would be so different for you guys over there. So the first thing would be you go to your GP here.
Okay.
And they will refer you to whoever.
Got it.
Right? Okay. It's like a distribution system. However, I mean, we're talking about pre-pandemic now, obviously, because now everything, you don't go to any doctor anymore, unless it's really, really bad.
Yeah.
But Yes. So with anything like long-term conditions, scoliosis, things like that, where it's not acute and where they know, whatever, it's not broken or anything like
Yeah.
that, it kind of gets stuck there.
Okay.
So a lot of times it will be like, yes, we can put you on a list for physio, but it's going to take a very long time.
Physical
So
therapy.
that is kind of the next kind of step where people will go look around and probably have some recommendations from their GP, which will probably be a chiropractor or a physiotherapist, first of all.
But it's almost they're being told, we really can't help you because you don't have a medical problem. So maybe you want to try this, this, and this.
Yes, exactly.
Yeah.
Exactly.
Okay.
So there is no kind of clear, and it depends on the doctor, it depends on the GP, what their kind of, what their experience is, or, maybe the people that they know around them. But really, that's when people are kind of left to their devices and do a little bit of.
They get frustrated. Okay, this says even though you guys have free healthcare there, it's not helping them. It's not helping them get better or feel better.
No, and it's not prevention either. This is another, this is another big thing, obviously, with scoliosis, because really you want to prevent it from getting worse, which is kind of, unfortunately, something that is being ignored a little bit. So in the NHS, which is our health system here in the UK, if it's getting to the point where you're having to have surgery, you're fine.
Until,
right?
Yep.
You are in the system. Now, once you do get to that stage, you are kind of in the system. But until then, you're kind of swimming around, not quite sure what to do. But obviously, you don't want to have surgery, right? That's like the last thing that you.
And that's the thing is even here too, the same mentality as someone who has common sense. I have a general practitioner who brought her daughter in because she took her daughter to scoliosis check. Yes, they found scoliosis, and their treatment was, we'll wait and see if it gets worse. And my patient said, well, what do you mean wait and see? If it gets worse, she needs a brace and then she needs surgery. Well, that's not acceptable to her as a mom. What do I do next? How do I get this thing taken care of before it needs that, to avoid that mental and physical disability I'm giving my daughter at that sense?
Yes, and can you imagine that fear, right? That, I mean, you've got children, obviously. I've got children. If you're like, this could happen, my child could have this really invasive surgery, and they're just sitting around and just saying, just waiting until it happens.
Well, we'll see if it gets worse at that point. If it does, then we'll do surgery, and then we can't do anything to prevent it. They're basically saying, we can't do anything to prevent it. We can't. But instead of saying, let's go see a yoga instructor, go see a chiropractor, go see someone to help you, they'll just kind of stay quiet. And I think for me, that's a form of malpractice because you're not helping your patients.
Yes, yeah.
That's in my mindset. Why not? If you can't help them as a healthcare practitioner, find them help somewhere else.
Find someone else. Yes, exactly.
That's my rub, if you want to call it that way. I sometimes I'll see people come in a couple times a year and they've already gone through bracing. Now they're in a surgical consult, coming for me to help. Versus I should have seen them 4 or 5 years ago when it was more manageable. So that's why I get upset sometimes.
Definitely. No, absolutely.
So when you start with someone with their working out, with their routine, maybe one-on-one with them, what do you start them to have them do, or what's your general steps with a new client?
With a new client, again, it depends obviously on pain or no pain and all of that. But we generally start with quite gentle movements first of all, just having them move around in different way and just seeing how they move. We look at the way that they stand, just from natural curves of the spine. So all planes, obviously.
So more of a visual inspection, if you want to call it, or see where they are.
Yes, exactly. Okay. So we're just kind of start of where they're at, really.
Yeah.
And then looking at how they move, you know, what is pain free, you know, what causes them trouble. Obviously, that's where we don't want to go. And yeah, just starting really gentle and starting to build it up. But I find it really important, again, that they understand why they're doing things, right? So it's rather than, so whatever I would give, I would usually say why I'm doing it and what kind of my thinking is.
Why is that important? I know why, but why do you think it's important for them to hear that?
Well, I feel this is part of the whole empowerment journey, and wanting to do this yourself, and again having this toolbox really that, you know, I can start to do different things. I know that if I do this, it makes me feel like this. If I do this, then it helps me with this. And then, so this is kind of the first step of, you know, getting some movement into areas maybe that haven't been moved.
Yep.
Probably the first kind of general rule, releasing areas that feel really tight. And with scoliosis, we have lots of areas that are kind of overstretched and tight, and that are locked and just generally haven't got much life to them. And then we start to work more on kind of, I don't like to say corrections, but let's say optimization of posture. So maybe tweaking a few different things, right?
How long is a session normally? What's your session like normally? Does it last half an hour, 45 minutes, an hour? How do you spread your sessions out?
An hour. It's usually an hour, which is a good kind of good amount. So like in a normal class, and I usually do a few sessions until people kind of really understand what they need to do, and then they can take it into other movements as well. So this is really the kind of step-by-step way. I want them to be able to move, first of all, feel a little bit better, and you know, release that tightness. Then we optimize the posture and maybe work on kind of slightly correcting things, the way that they stand, and then we take it into different yoga poses.
It almost seems like you're, okay, this is where you are. Let's get you to feel a little different. Let's understand why you're feeling different. Now let's shift things so at that point things become more optimal. And at that point, then we can work with that optimal position in your specific person's, I guess, scoliosis stage or degree. At that point, we can start doing yoga to allow your body to get moving even more. Is that correct?
Yes, yeah, absolutely. And by that point, they will have felt the benefits as well, right? And then by that point, they will have found that they feel a little bit better. And when they feel better, then they want to do a little bit more of that. And when they can see something, that's even more empowering, right? So I've got someone at the moment who's got quite a severe thoracolumbar scoliosis with a spondylolisthesis. So, you know, if you look at her x-ray, you think, oh my God.
Wow.
But, you know, she's like, she said to me the other day, my husband said to me, my back looks so much better. And like, wow. I mean, that is just, I mean, can you imagine that motivation that will give her, basically, to kind of...
It's motivation and confidence. Now I want to take the next step. How do I get this thing keep going so I can get better and better? And that you're seeing the light bulb, in my sense, the light bulb turn off, where now they're going from a depressed, anxious state, I'm alone, here's someone here to help me, to make me feel I can get this thing better, to where I have more confidence, it doesn't bother me, and people see the difference.
Yes, yeah, absolutely. That's
great. And with your YouTube channel, what do you normally do with the YouTube channel? Is it more of a weekly video you put out, or something where you have a library of videos, or what do you normally do with your YouTube channel?
I do have a full kind of library of videos, which I recorded over the last 3 years. Some of them are worse, some of them are better, you know. That's
all it is, yep.
With technology and all of that as well. So I was kind of putting out more like shorter practice videos that people can access. And then over the last year, I've kind of been focusing more on this sort of thing of like conversations. So I've got weekly conversations with other health experts who specialize in working with people with scoliosis, and we talk about, you know, the mental health side of it. You know, we talk about different approaches. We talk about pain. We talk about all sorts of things. So yes, so it's always evolving, and yeah, I'm really enjoying this kind of this medium as well. You know, it's fun.
Well, a lot of it is your understanding, and it's not just UK or the US. There's an international audience that needs your help, and they may be on YouTube, they may be on Google, they may be on Instagram, they may be on, I call it TikTok, but it's more TikTok, or on Facebook. So can you reach all of them based on your stories on Facebook and Instagram, based on how you want to present your information, and just talking to different interviewees too, like myself also, to get the word out more. And as you're out there more, as you know, people, when they're ready for help, they'll come and reach you. They have to be a certain mindset, a certain, if you want to call it, just time in their life to be ready to look for help. And you're there in their screen every day with a new video, with a new talk, with a new topic, or something that allows them to see an interest. All it comes down to with anything that we do, I think, Christine, is can we be ready when they're ready to help them so you can share the information?
Yes, yeah, absolutely. And as you say, you know, it has to be the right time for them. And again, one of my clients said the other day to me, "Oh, I wish I had found you kind of 10 years earlier." And I said, well, it would probably not have been the right time, right? This is the right time for you now.
Yeah.
And but I mean, how amazing is it that we can do these things, you know, and we can talk to each other in different countries in this way, and spread, you know, spreading your knowledge.
And I think a lot of it is when we do this and we have these cooperations, allows us both to see the benefit of being different parts of the world, really, and still have the same mindset of helping people with the same basic fundamentals of helping not only their body feel better, but also their mind improve, to build that confidence that they can get their health better on their own, in the sense where they're in charge of their health. I tell my patients, you're your best doctor. You have to search out my knowledge, other people's knowledge, to help you do the work to get better.
Yes, so true.
Yeah. And I put in the show notes too all your links to your website, your Facebook groups, in your Instagram too. How do you want them? What's the best way for them to reach you, or what's the best way to contact you, Christine?
The best way to contact me is probably, I like to hang out on Instagram.
There you go. I saw all your stories today. Man, you were busy.
So yeah, that's yogaberry.scoliosis. That's probably my preferred option. Email, obviously, so feel free to add my email as well. Are you on TikTok?
Yes.
Oh God. Okay.
Yes. And when you say, oh God, I have one of my videos has 1.7 million views. One of my videos has 1.1 million views. I will never get there with all my videos on YouTube combined. I will never get there on YouTube with those. But I got it early too. So for me, if I'm going to start TikTok, sorry, I keep saying TikTok, a lot of it is going to be just put your videos you have now on there, and make your Instagram stories into a TikTok. That's TikTok, sorry.
Yes.
At that point, I use the same content on all platforms, LinkedIn also. You know, so at that point, you're whatever you have, and this is for everyone. At that point, share it everywhere. So wherever that audience that needs your help, wherever they are, they'll see you. I talked to my banker the couple yesterday. Yeah, hey, I don't see you. I haven't seen you for 3 months, but I've seen you on LinkedIn every day. So it's like you said before, it's being in front of them when they're ready for your help.
Yes, absolutely.
So
well, I'm gonna have to get on TikTok then.
I'll see you there tomorrow on TikTok.
I will definitely check out your amazing videos on there. Sounds great.
They're entertaining. They're adjustment videos, you know, where people want to see and they scream and everything else they do. They have Tourette's sometimes too. I don't know what happens to them.
Brilliant.
Fun. It's fun. Entertainment. And part of, as you know, part of what we do is education, yes, but also entertainment.
Yes, yeah,
It keeps the audience happy.
Mm.
You know?
Absolutely.
Well, thank you for being the show. I'm going to end the broadcast. We'll talk in a second after in the broadcast, but thank you for the show. I'm going to repost it too on my personal Facebook. I'll send you the link after to share on your Facebook if you want to. That point, the more we share it, the more people see your message of how you run a yoga. I want to call it a healing for people dealing with scoliosis.
I love that. Yes.
And I'm not creative. I had C+ in all my English classes, so I have no creativity. That's just my top of my head. All right, thank you for the show. Appreciate it.
Thank you. Thank you so much for having me.
You're welcome. Have a good weekend. I'll go on the broadcast right now.
Sure.